If you're prescribing Prezista, Darunavir, you've probably faced the headache that is prior authorization. It's frustrating, time-consuming, and, honestly, just one more thing on your plate. But here's the good news. Navigating this process doesn't have to feel like pulling teeth. Stick with me, and I'll walk you through everything you need to know to get those approvals moving faster and with less stress. So, why does Prezista even need prior authorization? Simple, it's expensive. Insurers want to make sure it's absolutely necessary before they green-light coverage. Prezista is a powerful protease inhibitor used with other antiretroviral drugs to treat HIV-1, especially for patients dealing with drug resistance or who need a highly tailored treatment plan. Because of its high cost and critical role, insurers have to verify that it's being used appropriately and that all clinical bases are covered. The first thing you need to know is this. Every insurer has their own set of hoops to jump through. Some, like UnitedHealthcare, focus on detailed documentation. Blue Cross Blue Shield? They'll want proof that Prezista's part of a combination therapy. Aetna? They'll dig into whether it's medically necessary. Bottom line, tailoring your approach to the patient's insurance plan is half the battle. Here's how to get it done, step by step. Step 1. Check the patient's coverage. Is Prezista even on their formulary? If it is, find out whether it's under the pharmacy benefit or medical benefit, and don't forget to check if they require a specialty pharmacy. Some insurers have specific pharmacies you'll need to use to fill the prescription. Step 2. Gather your documentation. And I mean everything. This includes the patient's HIV genotype and resistance testing results, especially if resistance is a factor in prescribing Prezista. Add the patient's treatment history, including any failed therapies, and a detailed prescription plan that outlines the dosage, duration, and how it's being used in combination therapy. Trust me, the more thorough you are here, the fewer roadblocks you'll hit later. If this step feels like it's eating up more time than you have, it might be worth considering help from an outsourcing service like Staffingly. They specialize in managing prior authorizations for providers, helping you save time and reduce those frustrating back and forth delays. Step 3. Submit the prior authorization. Most insurers these days prefer online submissions. It's quicker and tends to be less error-prone, but fax or phone submissions still exist for some plans. Double-check you've filled out all the required forms and attached every document they've asked for. This is one step you don't want to rush because a single missing piece can lead to delays or outright denials. Step 4. Follow up. Insurers usually respond within 5 to 10 business days, but don't assume everything's moving smoothly. Pick up the phone and check on your submission. Make sure they've received it, and ask if they need anything else. A quick call can save you days of waiting, especially if there's an issue you can fix right away. And if you get a denial? Don't give up, that's step 5. Denials happen, but they're not the final word. File an appeal. This is where you might need to include additional documentation, like clinical studies or a letter of medical necessity from the prescribing doctor. And if the case is urgent, ask for an expedited review. Persistence really does pay off here, especially when you can back up the prescription with solid clinical reasoning. One last tip. Coding. Getting your ICD-10 and CPT codes right can save you from avoidable rejections. For Prezista, common ICD-10 codes include B20 for HIV-related conditions and Z21 for asymptomatic HIV status. On the captain side, you'll often use codes like 87536 for HIV-1 RNA quantification or 86701 for HIV-1 antibody testing. Double-check these before submitting, they matter more than you think. And that's it, a simple roadmap to make prior authorization for Prezista a little less painful. If you're still finding yourself swamped with the administrative load, outsourcing to a service like Staffingly can be a game changer. They handle prior authorizations efficiently, so you can focus on what matters most, your patients. Thanks for sticking with me, and I hope this guide helps make your prior authorization process a whole lot smoother. Let's get those patients the treatments they need, without all the hassle.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.